Hi, my name is Dr. Sandra Gomes. I'm a physical therapist here at ProClinix in Pleasantville. I'm here to introduce our initiation to a little web series to discuss a few potential exercises and some strengthening techniques going forward in ways that we can help the general population attack some of the things that they're going through every day. Okay, so talking about our first mini web series, general low back pain is something that we suffer through every day. Not all of us, but a typical large portion of the population, especially in modern day America when we're sitting in our chairs all day or doing constant standing working activities. So what we typically find with low back pain is that most people will arch their back like so. The reason this happens is because of a few things. Just for today's sake, we'll talk a little bit about why some of the tight muscles can cause this, and then we'll go into some strengthening stuff in the future. But what can cause this tilt going forward, which is known as an anterior pelvic tilt, is tightness in the hip flexor muscles right along here. There's a key muscle called your iliopsoas, which is a big group of a couple of different muscles. Essentially, that muscle goes right into the front hip and attaches again to that lower spine. Another muscle that can also draw our hips forward like so is our rectus femoris muscle, which is one of the key muscles in our quadriceps group right along here in the front. And typically you'll find that there's also a lot of tightness in the paraspinal group right along here, which are your erectors, and they keep you nice and straight up. The problem with this is that typically when we're in this position, we cause a lot of weakness in our core and cause a lot of weakness in our glutes, which we'll talk about in our next series. Today we'll talk a little bit about why we need to stretch out these muscles along here, and we'll also talk about stretching out some of the muscles along here, because typically we'll find that the hamstrings and another key muscle in your glute called your piriformis might compensate for that glute muscle that needs that strength. So I'm going to show you a few ways to do some of these stretches, and we'll get started. So for the first stretch, we're going to use a little foam pad just to protect our knees while we go into a lunge position. So I'll show you a side view, and we'll also talk about it in the front. So typically we're right here, go into that lunge position. Now again, with that low back pain, sometimes people find it comfortable to be in that anterior pelvic tilt, and that's causing a lot of that strain. So this is a good stretch to start with because we'll show you how to open up out of that position. So what we'll do is round at the spine like so, almost as if you're flattening your back, keeping it nice and straight, and squeezing at that lower buttock area. When you do this, you'll feel a nice pull and stretch in that front hip area, which is that iliopsoas muscle group we were targeting in the first place. I'm going to show you how to do it from the front view as well. So we're right along here, flip the foam around, go right back into that position, and same thing, we'll round out a little bit at that spine and keep it nice and straight. Again, feeling that stretch right along here. Now that all of that is discussed, we'll talk a little bit about stretching out some of those hamstring and piriformis muscles as well. So for the hamstring muscle, you can use something like a strap. I know that not everybody has the handy dandy stretch out strap at home. So what you can use is a belt where you could tie a loop at the end of the belt. You can use a robe, you can use a towel, or you can use a dog leash to essentially mimic the same thing. So before we get into this position, I'm going to talk about a few things that we can do to feel comfortable. So you want to make sure that you're in a nice flattened area, almost like so. You can use a yoga mat at home to get into this position. So now that that's discussed, we'll get on it and I'll show you how to do it. So we'll use our stretch out strap, or our belt or towel or whatever you have handy at home. And what we'll do is lay down. So typically when we're in this position, most people will try to stretch out like so. That's not always the best case scenario because we're, again, arching that low back and not keeping it protected. So when you do stretch out the hamstring muscle, you want to keep the opposite knee bent, just to keep that nice lower back flattened and in the proper posture. So what we'll do is now raise up the leg, and what most people may do is try to keep bringing up that leg as much as possible. That's not always the best way to get this stretch. Typically, when you want to stretch out this hamstring muscle group, you want to keep this knee nice and straight as much as possible to get that leg in a stretched out position, and you'll bring it up to a position that feels strong but comfortable. Typically, it's about the same height as the opposite knee. Don't try to force your way into it, because then eventually you might bend that knee a little too much, and again, take away that tension that we need to get that stretch. So one more time to reiterate, you want to keep that leg nice and straight so you feel a strong but comfortable stretch in that back hip area. And now that we discussed that, we'll talk a little bit about stretching out our piriformis muscle. So we can put our strap down. And with the piriformis muscle, there's two different ways to do it. We'll go over the general version for people who are a little bit more flexible, and we'll talk a little bit about a modified version for people who are not as flexible, and also a way to do it where you don't feel as much of a pull and pain. And before we get into that, I would like to show you where that piriformis muscle is so you have an idea of what exactly you're stretching. So I'll use my handy dandy hip model right here, and typically that piriformis muscle goes right along that buttock area. This is the back of your pelvis, and this is that hip bone. So it'll go right along that buttock area into that hip bone, right along here. So when we do the stretch, you want to feel the hip stretch right along this area, which I'll point out in the stretch. So we can get back on top of the flat surface, typically a yoga mat or a hard table like so. And what we do is we bring the opposite side of our ankle over to the opposite knee, like so. Once we're in this position, we're going to use both of our hands to grab the back of our hip and draw it close to us. So this is the non-modified version. It's usually a little bit more rigorous and you get more of a stretch, but if you feel pretty good with it and you feel a nice stretch along this buttock area, then it's probably the best for you. So we would hold right here. And now I'm going to show you the modified version of this. So what we do is essentially a similar concept. We bring the opposite ankle over to the opposite knee. And what we do is we grab the outer side of our closest knee to ourselves and draw it towards the opposite shoulder. Now sometimes when people are a little bit more flexible, they may not feel that stretch in that buttock area. So the other version may be best for you, but make sure not to do these stretches if you're in pain. Now this may also feel like a good stretch for most, and it's a modified version where you don't have to fold yourself into a pretzel and you feel pretty good. So we're going to hold here and you should feel a nice stretch in here. And now with that being said, I'm sure most of you are wondering, how long do I do these for and what's the whole purpose? So essentially when you're doing this, you want to achieve at least a full minute. So what we do is typically here in the clinic, we'll do 2 times 30 seconds, which essentially achieves a full minute of stretching on your first go around. So we'll do one set of 30 seconds on one side, another set of 30 seconds on the opposite side, and we alternate until we achieve that 2 times 30 seconds. When you feel more comfortable and a little bit more flexible, you can always aim for longer and try to aim for at least a 2-minute stretch with each. And then, if you're starting off any other exercises, which we'll discuss in the future, about strengthening the core, you definitely want to get a nice 5-minute warm-up with these stretches, and that's a good way to start your exercise routine. So that being said, sometimes these stretches are not always the best for everyone. These are the typical ones we use for low back pain. But if they don't work for you, or if you're still in a lot of pain, please feel free to reach out to us. You can always be evaluated by a physical therapist on staff, or you can talk to your doctor for other techniques that you can use to feel better, like chiropractic services, or acupuncture, or massage therapy. But either way, feel free to contact us and reach out with any questions or concerns. We're more than happy to answer. This is just a little general basic guideline and some exercises and stretches you can do for that low back pain. It's very nice meeting all of you, and please feel free to reach out if you need anything from me. Take care. Looking forward to seeing you in our next web series.